According to George Benjamin, ND, a healthcare provider of administration and a practitioner, vaccines are said to be one of the world's most greatest public accomplishments of all time. For centuries, the public health has relied on vaccines to control diseases and outbreaks, such as things like smallpox, the flu, whooping cough, hepatitis, HPV, and so many other diseases. We have relied on vaccines to help at least tame or get rid of. And now, of course, the coronavirus. The coronavirus was first reported in Wuhan, Chinese, on December 31st, 2019. The virus spread nearly to every other country through the food in no time. The World Health Organization then declared a global pandemic. By mid-December, by midsummer 2020, 2 vaccines had been released. That was the Pfizer and the Moderna. So they began to start trial periods on these vaccinations, but they were created in such a short period of time. This, of course, worried people because usually a vaccine takes longer and is tried on animals and then humans, but the people feel that they just skipped that step and went straight to let's give all of our people this vaccine in order to get rid of this global pandemic, because we were having so many people die. According to CDC, on August 1st of 2020, 347 million doses of COVID-19 vaccine had been given out. Of those 347 million, only 165 completed the 2 doses it took to become fully vaccinated. So the Johnson & Johnson, you needed 1 vaccine in order to be vaccinated, but for the Moderna and the Pfizer, you do need 2. So that would mean it took to become fully vaccinated. There was about 50.2% of the United States that was fully vaccinated as of now. The statistics are said to be rising every day. Every day they're offering new incentives, or just people are finally seeing that they should get this vaccine or that they shouldn't. Now I know that they are starting to, according to the news channel, they are starting to do away with being allowed to come into certain restaurants, like in New York City, without being fully vaccinated. The question here isn't if you should get the vaccine. The question is, since the vaccine was created in such a short amount of time, what could be the after effects, the negative generate of the results? Should you be required to get the vaccine, or should you have your own freedom of choice in that matter? George Benjamin, MD, mentioned vaccine documentation in his article. So vaccine passports are premature solutions to a challenging problem. The vaccine documentation, as stated by the CDC before a vaccine is able to be required, the federal requirement mandates you go through 5 things when administering the vaccine. So you must have the name of the vaccine, the manufacturer, the number and expiration, the lot number and expiration dates of that vaccine, the date that it was administered, and lastly, the date that it becomes expired. So we have basically everything but the last one, which is the date that your vaccine is expired. Since we've all gotten it, we know that there's a new Delta variant, but we are not exactly sure how long the vaccine will last to protect the ones that are vaccinated from these other different variants or just the regular COVID-19 strain. So, while conducting my research on the COVID vaccine, I found many reasons why you should be afraid